Good afternoon, everyone. I'm going to present a case on pinworms in the conjunctival sac of a 14-year-old girl. So, Enropius vermicularis, also known as pinworm or threadworm, is a large intestinal nematode which has high prevalence among the children and peripubertal age in our country. The transmission usually occurs by autoinfection, like fungal contamination of embryonated egg deposited by gravid female worm on the perianal and perineal region. So this is a rare case report of ocular endobiasis in which a 14-year-old girl presented with discharge of live motile worms from her left eye, it's conjunctiva. In recent literature, 6 such cases were reported from India and Chicago, USA. 14-year-old girl presented to a tertiary care hospital with complaints of worms coming out from her left eye for 6 months. The worms were moving towards the lateral canthus. A total of 12 to 15 such worms were discharged over a period of 1 week. She used to take out worms manually and asymptomatic over next 2 to 3 weeks. Worms were expelling out from her eye on irregular intervals. She reported to us in her second episode of symptoms. This was insidious onset and was associated with irritation. There was no history of perianal itching or passage of worms in the stools. Similar complaints were not reported among family members. Patient's conjunctival sac was washed with normal saline and worms were collected for saline wet mount and microscopy. Microscopy revealed a gravid female of Enrobius vermicularis, which was identified using the cervical alley and double pulped esophagus. Stool examination of the patient and family members were done and revealed no findings. Treatment: patient was adjusted to maintain healthy and hygienic habits. After consulting a pediatrician, oral antihelminthic medication, this is tablet mebendazole 100 mg and tablet pyrindapamide were given to both patient and family members, repeated after 2 weeks. Follow-up after 6 months revealed no further complaints. So discussion: humans are the only host of large intestinal hematode of Enrobius vermicularis and embryonic eggs are the infected form. The prevalence, as we see, the maximum among the school-going children, and ocular migration of the adult female worms through finger contamination may explain the presentation in the above case. So these are the reports which reported in India as well as USA. Conclusion: Enrobius vermicularis is a very common large intestinal parasitic infestation of children and adolescents. It can also rarely be isolated from unusual sites. Ocular migration of adult female worms through finger contamination may explain the above case presentation. It should be taken into account for effective diagnosis and treatment. This is my reference.